morning. I am Kristen, and we are going to be talking about reducing CAUTIs, implementing a nurse-driven catheter removal protocol. Hospital-acquired infections, or HAIs, pose significant challenges in healthcare, with catheter-associated urinary tract infections being among the most common and preventable. CAUTIs often result from prolonged use of indwelling urinary catheters and poor hygiene practices, leading to increased patient morbidity, longer hospital stays, and higher healthcare costs. However, research shows that nurses can play a pivotal role in preventing CAUTIs through timely catheter removal, proper insertion techniques, and routine catheter care. The goal of this project is to evaluate whether implementing a nurse-driven catheter removal protocol can effectively reduce CAUTI rates in hospitalized patients compared to traditional physician-led management. By empowering nurses to take the lead in catheter removal, we aim to improve patient outcomes while reducing healthcare burdens. Background and rationale. CAUTIs remain a persistent issue in healthcare, with an average incidence of 9.86 per 1,000 catheter days in non-intensive care units. Standard physician-led catheter management often results in delays in removal due to hierarchical decision-making. However, research supports nurse-driven protocols as more of an effective approach. Studies have shown that when nurses are empowered to make timely decisions about catheter removal, CAUTI rates decrease significantly. Implementing this protocol could help reduce infection risks, enhance patient outcomes, and lower costs. Objectives. The primary objective of this project is to implement a nurse-driven catheter removal protocol and reduce CAUTI incidence. This will be achieved through the following specific goals. By the end of the 3-month implementation period, 90% of nursing staff will complete training on the protocol. Within 6 months, CAUTI rates will decrease by 25% as measured through electronic health records. Daily catheter necessity assessments will be documented in 90% of patient charts within 1 month of implementation. Compliance with timely catheter removal will reach at least 90% within 3 months. Patient hospital stays related to CAUTIs will be reduced by 15% within 6 months. Methodology. This project will use a quasi-experimental pre- and post-intervention design to compare CAUTI rates before and after implementation. Baseline data will be collected for 3 months prior to the intervention, and post-intervention data will be collected for another 3 months. The intervention itself involves training nurses to evaluate catheter necessity, follow evidence-based guidelines, and remove catheters when no longer clinically indicated. Staff will also be trained on proper insertion techniques, catheter care, and patient hygiene education. Implementation plan. The implementation begins with a 2-week training program for nurses, including interactive workshops and hands-on demonstrations. Over 3 months, the protocol will be rolled out across hospital units. Compliance will be monitored through regular audits, staff feedback, and patient care documentation. Any identified barriers, such as knowledge gaps, will be addressed with additional training or resources. Evaluation and expected outcomes. The effectiveness of the protocol will be evaluated by comparing CAUTI rates before and after implementation. Key metrics include the number of CAUTIs per 1,000 catheter days and the average duration of catheter use. A significant reduction in CAUTIs is expected, along with shorter hospital stays and lower healthcare costs. Additionally, empowering nurses to take the lead in catheter management is anticipated to improve job satisfaction and foster a stronger culture of evidence-based practice. Conclusion. In summary, CAUTIs are a preventable but persistent issue in healthcare. This nurse-driven catheter removal protocol offers a practical, evidence-based solution to reduce infection rates, improve patient outcomes, and lower healthcare costs by empowering nurses to make timely decisions. This initiative has the potential to drive significant improvement in patient care and set the stage for broader hospital policy changes. Thank you. And if you have any questions, you can leave a comment. Thank you.